There's a new study that's warning us about superbugs. It says that over the coming decades, the superbugs will kill millions of people worldwide. Dr. Donald Vinn is an infectious disease specialist at the MUHC. Hi, Don.
Hi, Mitsumi.
So, what are we talking about when we're talking about superbugs?
So when we talk about superbugs, the other name for it is antimicrobial resistance. And this occurs when microbes, which includes viruses, bacteria, fungi, and parasites, evolve to the point where antimicrobial drugs that previously worked against them are no longer effective. And alarmingly, an increasing number of microbes are resistant to multiple classes of drugs. As a result, these microbes become more prevalent in our environment, and infections caused by them become harder to treat. In Canada, antimicrobial resistance causes 5,400 deaths each year, and the WHO estimates that globally, every year, about 1 million deaths are responsible or caused by superbugs directly, and an additional 5 million more deaths implicate superbugs. But they warn that if we don't act, that number can go up to around 40 million deaths annually by the year 2050. So, of course, this number can worsen as some countries weaken their public health policies.
Okay, I'm going to go with superbugs as opposed to antimicrobial resistance. These
Yeah.
superbugs, where are they coming from? Why are they increasing?
You know, germs are smart. They've been around way longer than humans for a reason, all right? And when they multiply, they can acquire genetic mutations that can then make antibiotics less effective. Some microbes are also able to directly transfer pieces of these genetic materials to surrounding microbes, helping them become resistant to drugs they haven't even seen yet. And these microbes that have acquired these genetic advantages, well, they'll survive more than less resistant strains. The problem then gets worse when we overuse or misuse antimicrobials, like taking antibacterial drugs for viral infections or using too much antimicrobials in farming. And what happens is this speeds up the selection process, creating superbugs that our medicines can't eventually fight. But it's not just about abuse of antimicrobials because pollution, dirty water, and poor sanitation also help superbugs grow stronger. So all of these are drivers of resistance globally.
But aren't researchers working on this? Will it not be possible to find new drugs that can fight these superbugs?
Yeah, finding new drugs will be crucial, but we cannot just rely on that strategy to outrun superbugs for two reasons, Mitsumi. First, we have to remember that germs adapt rapidly. Take penicillin, which was the first miracle antibiotic, discovered in the 1940s and that saved millions of lives. But the first penicillin resistant bacteria appeared in hospitals within just 2 years of its use. Secondly, developing newer antimicrobials isn't rapid. This usually takes like two paths, either by modifying existing ones, which is like remodeling an old house. It's faster and cheaper, but the advances are incremental, or discovering brand new ones, which are usually found out in nature. But this is like looking for a needle in a haystack and then converting that needle into gold. As an example, from 2017 to 2024, only two new classes of antimicrobial drugs entered the market. So, hoping to find new drugs won't solve this problem.
We're also hearing reports, Don, that falling vaccination rates are contributing to this. But vaccines combat viruses, so why would this be an effect on superbugs?
So there are vaccines that combat viruses like flu, COVID, RSV, and then there are other vaccines that target bacteria, like the ones that cause pneumonia, such as pneumococcus. Globally, these vaccines have actually cut death rates, particularly in children under 5 years old, by 50%. Now, the antibacterial vaccines, they provide direct protection against these bacterial pathogens. But the antiviral vaccines are also important because they prevent the viral infections that would lead to the lung damage that increases susceptibility to deadly bacterial pneumonia, especially in older adults. So, by stopping the initial viral infection, these vaccines reduce hospitalizations and antibiotic use and death. So, all of these vaccines against viruses and bacteria, they really create a powerful cumulative defense.
So, Don, what can each one of us do to protect ourselves from superbugs?
Yeah, so at an individual level, the best defense against superbugs is to prevent infections in the first place. And that's done by staying up to date on vaccines, practicing good hygiene like hand washing, and using antibiotics only when prescribed and as prescribed. But the fight against superbugs actually demands regional and global responses where science guides policy. We need coordinated action across human, animal, and environmental health sectors to track resistance, control antibiotic use, boost research for new treatments, and address root causes like climate change and forest fires. Because while individual actions matter, without systemic change, even the most careful person remains at risk.
Okay. Thank you very much for this, Don.
Thank you, Mitsumi.